Well, we will call the Committee on Health and Human Services Committee to order. Roll call, Madam Clerk.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki.
Here.
Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Commissioner Killeen.
Here.
Chair Baker McCormick.
Here.
You have a quorum present.
Next item, please.
B, Chairwoman's remarks.
I have none today.
C, approval of the September 28th, 2021 meeting minutes.
I'll move their approval, Madam Chair. Colleen.
Support. Marecki.
Okay, it's been moved and supported. All those in favor?
Aye.
Aye.
Any opposed? Motion passed. Next item.
D, unfinished business. There is none listed.
All right, next item.
Item 1, under new business, an update regarding COVID-19.
All right, and do we have the director here today or Ms.
Yes, you have the director.
Okay,
Good
great.
afternoon, Melita Jordan.
Full title, please.
My name is Melita Jordan, and I'm the director for the Department of Health, Human and Veteran Services.
Thank you. Welcome to the meeting today.
Thank you
And
very
you can go
much.
ahead with your report.
Okay. I'm going to provide the COVID-19 report for October the 2nd through the 9th, and would like to share with you that over the past week, we have had a total of 1,961 new cases reported, with 5 new deaths identified. On average, we have had 280 cases per day. That's a 5% increase that is in confirmed cases from the previous week of 926 through 10/2, which was 1,863 new cases were reported. We have a positivity rate of 7.8, which actually puts us at, according to CDC, in the high transmission rate. We also have, in terms of the communities, of course, I just dropped my paper, I'm sorry. As I mentioned, the positivity rate, I'm sorry, I said 7.8, I meant to say actually 7.9% out Wayne County. In addition to that, we have a number of breakthrough cases, still remains pretty much less than 1% in out Wayne County. We have a total of, because I just dropped that too, we have a total of, trying to give you the number of total breakthrough cases totally. I'm sorry. So we've had a cumulative number of cases of 118,402 cases and a total of 2,664 deaths since March of 2020. We've had 1,889,573 COVID tests that have been performed since March of 2020. We have also had 52% of new cases have been identified as female, and 48% of our new cases have been males. In addition to the mean age for individuals contacting COVID was 36.5 years of age. In addition to, we still have more than individuals who are receiving the COVID vaccine again, continues to be 75 plus years of age and over. In terms of the number of individuals that are still, we're challenged in terms of getting additional COVID vaccines, is again between the age of 12 and 18. In addition, we have the top 5 municipalities continue to be Dearborn, 207 cases, or 11% of the total cases, followed by Canton Township, 164 cases, 8% of the total number of cases, and Livonia, 160 cases, or 8% of the total cases, followed by Taylor, 120 cases, or 6% of the total cases, and Westland, 114 cases, again, 6% of the total cases. In terms of the number of outbreaks, as I mentioned, we've had 1 new outbreak and 11 ongoing outbreaks that we're looking into as it relates to schools. And so we're doing follow-up cases and monitoring at the various schools. We did send that information over. Commissioner Khalid had asked for that previously, so we've sent the information over to your office, in addition to providing the information around masks as well. So we wanted to make sure we followed up on that for you. I'm trying to see if there's another area. In terms of boosters, we're continuing to make sure that we are providing boosters not only at our site, the health department site, but also at your local Walmart, your local COVID targets, and various pharmacies across the county are continuing to do the boosters as well. Also, as I just mentioned, I wanted to make sure that I continue to say that the breakthrough is less than 1%, and that we've had a total in the county of 3,169 total vaccine breakthrough cases. And of those, there were 55 deaths, 87 hospitalizations, and 134 reported variants of concern of the individuals who had a breakthrough. Wayne County makes up 10% of the state's total 32,802 breakthrough cases. We're continuing to provide in-home vaccinations, in addition to providing, as I mentioned, boosters, and also wanted to bring to everyone's attention that we are in flu season and would encourage everyone to get their flu shot. And again, at the various places that you could receive your vaccine, you can also receive a flu shot as well. You can have them performed at the same time. However, just because of the soreness of one's arm, you might want to space it out from getting your flu shot and your vaccine shot at the same time. We also have provided the information as requested by Commissioner Anderson around the history or historical background as it relates to vaccines. That information has been sent to your office as well. That concludes my report, Madam Chair.
Thank you. Thank you so much. Are there questions? And I see Commissioner Anderson. You're muted.
I guess that would help. Thank you. Welcome, Mrs. Jordan. I appreciate, I haven't seen the information yet, but I don't know if you sent it directly to our individual offices, or did you send it to the clerk, or?
We sent it to the committee clerk for them to disperse to all of the members.
Okay, then maybe it has come through and I just didn't see it because I'm not back and forth in the office and trying to manage the multiple emails going.
I understand. I understand.
But I
we just
appreciate
got that out. Actually, we sent it earlier today, so it wasn't that we sent it much in advance. I actually sent it earlier today to make sure that it would be available perhaps at the time of the meeting, but it did go out, and we sent it to the clerk's office for all of you to receive.
All right, thank you. One question, if I could, and I'm not sure if this is in your department or if it's in Department of Public Service. I think because of it being environmental, that it would be in your department. would you have, I'm trying to remember Patrick's last name, that works on the environmental issues for the county. Is he within your purview?
I'm not sure of the name, Patrick, so I can't respond to that. Environmental health does sit under public health.
Patrick.
So,
Patrick Cullen.
Patrick Cullen, thank you, Commissioner. I'm trying to, in what they had done, that had been the department that had handled hazardous waste disposal sites, collection sites for the public to bring things like that. And I'm not sure, and like I said, I know you're relatively new in the department still, but they, of course, were canceled last year because of COVID, but they were supposed to start them back up this year. They had some issues with the first one they tried to do. And do you know anything about that, or is that, if that's not in your department or under your umbrella, then I'll get it to the right person.
sure. It's not under my purview. I will say I am familiar somewhat with the department collecting hazardous waste because we are still in Flat Rock handling the previous gas leak that we've had with Ford. And so they actually provided pickup for the residents a week ago and spent the day there making sure that they could pick up all of the types of hazardous waste that may be in actually people's homes, you know, such as gas cans and various things that could create fumes. And so I can certainly ask my director, Carol Osterberry, to look into that and get you the appropriate office and the appropriate contact.
Okay, I see she's online
Yes.
now. And the reason is that now we've got 2 years of buildup in a lot of homes in their garages, actually, and they're getting quite antsy about, okay, how do we get rid of this stuff?
Yes.
And it certainly is important to the county to see this disposed of properly. And for the neighborhood, we had, before you came here, we had an incident where the sanitation workers, I believe it was the sanitation workers, had an explosion because of something that should not have been put in the garbage pipeline. But anyway, I'll.
Yes.
And
that has been a major, thank you. And I appreciate that. And that, again, was a major concern that we have in Flat Rock. And that's why we made sure that they were there to be able to help residents dispose of those types of things that might be in their garage and or in their basements. And so I want to say it's public works or public safety that it comes out of. But again, I can make sure that Carol get that information to you with who would be the appropriate office as well as the contact person.
Patrick Cullen is the person, I know, if he's still with us.
Okay. Thank you. But we'll follow up with that information for you.
Thank you so much. Thank you.
Thank you, Commissioner Anderson. Was that it?
That's
Any
it.
more
That's
All
it.
right.
Thank you.
Thank you. Commissioner Dobb.
Yes, thank you, Madam Chair. Hi, George or Jordan. I just have a question about the boosters. We're still only doing boosters for immunocompromised and age 64 or 65 and up. Is that correct?
We're doing boosters for the immunocompromised, is correct, but we're also doing boosters for special population that was designated by the CDC and by the federal government. And so that the age group is 18 to 64. If, again, chronic disease or an underlying medical condition, and also those individuals that are in long-term care facilities and those healthcare workers who work in institutions and or, again, have underlying medical conditions are also for the booster as well. We did send that information out with the e-communication yesterday to everyone. So hopefully your office did receive it. If not, we can make sure that we send it again.
Okay, I'm sure I got it. It was just kind of a busy day yesterday. I will go back and look for it. And then do you have any updates on when we can expect approval for the booster shot for everyone else or any other groups coming up?
Well, Moderna is currently in evaluation by the FDA. We anticipate something perhaps in the next couple of weeks. Also, Moderna has also submitted to the FDA for approval of a COVID pill that they believe will also prevent and or reduce COVID. And so that's also under review currently at the FDA. But that may be a little bit longer coming out than it will be for the booster. So, and Johnson & Johnson, they also too have submitted to the FDA for approval for a booster, but again, that has not yet been approved.
If Moderna gets approved as a booster shot, can someone who has received the Pfizer shot before get a Moderna shot as a booster? Is that a
No.
possibility? I'm sorry.
It's recommended that you actually receive the same shot that you received for your first 2 doses, that you receive the same. So if you receive Moderna, they would like for you to get Moderna. If you receive Pfizer, you should be getting the Pfizer. And so they're not necessarily wanting you to do interchangeable. It would be a specifically special circumstances if that was to occur with it. Nothing was available. But we do have enough supply that we can provide individuals with the choice of vaccine that they previously had. So we have not ran out at all.
Okay. And then one last thing, vaccinations for younger children under age 12. Any updates on that getting approved?
That's certainly going through as well. And the expectation it would be out by October 31st before Halloween is the last I heard. So we're looking for it any day. So I'm thinking it's going to be out before the Halloween day, which is the 31st.
Okay, great. We're looking
So
forward
we'll let
to
you
that.
know as soon as we find out, but that is anticipated.
For sure. Thank you. That's all I had, Madam Chair. Thank you so much.
Thank you, Commissioner Dobb. Commissioner Vice Chair Colleen.
Thank you, Madam Chair, and good afternoon, Director Jordan.
Good afternoon, Commissioner.
Do you have any insight at all? I mean, I've been tracking all of the state reports right from the beginning. The ones coming out of the weekend are always low. Back when it was a 2-day report, now it's 3 days. Like the one that came out on Monday showed right around 3,000 per day over the weekend. But that was up from the previous Monday report, which was like 2,800 or something on average. But then when we got, so 3,000 last Monday over the 3 days average. And then by the time you get to the Wednesday and the Friday report, now we're looking at over 4,000 per day, which was higher than the previous week on those 2 days. Those 2 days were about 3,800. So I don't want people to be under any illusion when they see some of these numbers like, oh, it's slowing down, it's going the other way. Do you have any insight as to why those weekend numbers are low? Are hospitals not reporting, or what's the deal there?
I'm not sure. I think it could be a delay, but I will check with my epi people to get a better sense of why that's the case.
Well, if it's easy
I
enough.
agree with you as well. I've seen that the same thing, but I'm not quite sure what's actually happening between Sunday through Monday afternoon when we get the latest numbers out.
Well, I wouldn't put any resources into finding out just for me, but I just like to point that out to people. It's the 7-day floating average that tells the story, where you smooth the data out over time. And that continues to be a steady upward climb. I think the fact that 60% of the state now has 2 doses, certainly it's not as steep a climb as it was. But I'm looking at 30% of the state with nothing and another 10% with only 1 dose. There's nothing to stop this thing until more people get vaccinated, right? It's that simple.
That's correct.
And I'm also concerned, and I don't know if you can speak on it. I'm actually a little bit shocked at Detroit's numbers. The high number of people, we only got about 1/3 of my city that have been vaccinated. And yet their numbers seem to be low and lagging. I know you referenced it on the phone call this morning. And I've been concerned about that there may be, I don't know what's going on. But again,
as I mentioned. As I
Yeah.
mentioned earlier, I've reached out to their epidemiologists to find out exactly. I am having some challenges in understanding their data as well. So I just reached out to their epi people to get a better understanding. I'm waiting for them to respond to my request so that we can have some conversations so that we can understand and I can bring that information back to you. But at this time, I really don't have an answer.
Okay, yeah, because it just doesn't, it's not right to me, you know, that the vaccination numbers are what they are, and then the numbers they're
The
reporting.
positivity rate is so low.
And you know, and I keep wanting to make the case, get vaccinated, and I don't want people to relax like, oh, everything's fine in Detroit.
No.
So I'd be curious if we had better knowledge of why that is the case. I hope we don't have a sneaky, infections going on out there that are not.
That's not being picked up.
Correct.
I suspect they will be answering, but it's like I said, as soon as I get some information, I'll be happy to try to put something together and then share it with everyone. But at this point, I really do not understand the data collection and or the report out right now on Detroit. So.
Well, it's good to see you every 2 weeks, and thank you, Dr. Jordan.
Thank you.
Thank you, Madam Chair.
Thank you, Vice Chair Colleen. You know what, I wanted to ask about African Americans being impacted by COVID more so than any other population. Has there been any more efforts in finding out why that is and or working towards some type of resolution?
Well, I think that, again, from the data that's out there, again, as you can imagine, there are a number of underlying medical conditions that African Americans tend to have that's disproportionately affects our community than others. For an example, hypertension, diabetes, renal disease, cancer, all those things have an impact, as well as obesity. And so those are underlying risk factors for COVID as well. And because of that, we oftentimes may have what we call lower protective factors. And so therefore, it is important that, again, we try to safeguard our healthcare by preventative measures and such as healthy eating, healthy lifestyles, decreasing tobacco use. Those things certainly contribute, along with decrease in alcohol use, decrease in any substance abuse. Those types of things certainly contribute to underlying risk factors that can certainly lead to COVID and or deteriorate an existing condition that one already has. So with that being said, those are some of the things, as well as what we call weathering. Weathering is a induced stress related over time that individuals live under tremendous amount of anxiety and stress, which does have a deleterious impact on our health. So trying to minimize those things, increase in exercise, increasing the endorphins within our body certainly does help to warn those things off.
Thank you. In fact, I'm actually having a meeting tonight because my district, Northwest Detroit district, was hit the hardest by COVID. And so we're putting together a series of workshops. We're working with Michigan State University to ensure that we do better. And for the first one is about healthy eating.
Good.
That's tonight at 6 o'clock. So if anyone wants to join us, we'll have that workshop. It's about what's in our food and reading food labels, how important that is. A lot of us don't understand the importance of reading the food labels. So
Absolutely.
that's
So is it a Zoom meeting?
It is a Zoom meeting.
Okay.
Yes. Yeah.
And if you could
I'll send you the information when I get off the call.
Great, that would be great. Because I was going to say, in terms of reading labels, oftentimes there's high sodium content. Of course, in various labels, there's high glucose or sugar levels that's in food. And so it's important to understand not only how to read it, but then to make sure that you can avoid a number of those types of canned goods and so forth. So excellent.
Yeah. All right. Well, thank you so much for your report. And we will see you, I guess, in another 2 weeks.
Yes.
Thank you. All right, Madam Clerk, next item, please.
Item 2, revision of resolution number 2020-389, a retroactive 3-year agreement with a 3-year option to renew with Oakwood Healthcare.
Thank you. Can we have someone just go over this revision with us?
Yes, Carol Osterberry, Health Officer, HHVS Direct, or HHVS Department. And this is, no amendment, no budget, change, nothing like that. This was a typographical error when the resolution was, just written and entered into the system. So we just need to have the account numbers changed where account number for 221-605-7300, it was listed as the 960,150. That will then be in the account number 221-605-81100. And then to flip, then the 132,000 will then get put into the 221-605-763,000. Like I said, just a typographical error, no amendment to the contract, no amendment, no changes in the dollar amounts. It just needs to get flipped.
Okay, and it's considered retroactive because?
This was not a retroactive contract. I mean, I
Right.
know myself, when we put this through, I don't know why that says retroactive. I remember when we, executed this contract, it was not late. No.
Okay. All right, thank you for clarifying that.
Yeah, I said that on there, and I don't know why someone had put retroactive. It was not a retroactive contract.
Madam Chair, I'll move that item.
Thank you. Is there support?
Colleen supports.
Okay, it's been moved and supported. All those in favor, let's do a roll call. Roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. Looks like the motion has passed. Are there any objections? All right, next item, please.
Item 3, requesting commission approval of a 1-year fiscal year 2022 local health department comprehensive grant agreement with the Michigan Department of Health and Human Services.
All right, looks like this is a grant. Is there any questions around this from any of the commissioners, or would you like it discussed further?
I'd move the item, Madam Chair. Anderson.
I see Commissioner, Commissioner Colleen, go right ahead.
Yeah, I was waiting to see if on support.
Mhm.
Who had this contract before
Yeah.
Oakwood had it? How long have we been doing this testing?
Oh, are you talking, Carol Osterberry through the chair, to just clarify, are you talking about the contract with Oakwood for the tuberculosis?
Correct.
Oakwood had it before. Yes, Oakwood, they won it before, before that. That was my first contract here, was with Oakwood, yes.
Okay, because I was surprised there's only one respondent. What is the trajectory, Ms. Osterberry, of tuberculosis? I had heard it was on the rise a little bit.
Yeah, very good question. Our numbers have stayed steady. We have active case management on between 20, 25 a year. So it's about, 2 active cases per month.
Okay, because as an old high school teacher, before I got in this job over at Denby, tuberculosis was something you paid attention to a lot in high school with high school kids around. So I was just one. So we're pretty good as far as the amount of tuberculosis that's out there, right? Pretty good.
That is correct. And we are very much, whenever case is identified, we are able to, work very quickly, work very closely with Oakwood and the primary care physicians there to get our clinical nursing staff and the case investigator right on the case. So it has been a very well, a good process and, collaborative with Oakwood.
So if I could add to that, this is Melita speaking. Just wanted to add those individuals that, of course, are institutionalized or live in close spaces, individuals that are in our correctional facilities. We certainly check for tuberculosis, as well as in nursing homes, we check for tuberculosis. And again, we recommend individuals that are in close contact, small dwellings, where there are many people within a facility, should be also tested at least every 2 years for tuberculosis as well.
Kind of like a high school. and the teachers, we made sure that teachers in DPS were tested on a regular basis. So thank you for that. And Madam Chair, I will second the motion.
Thank you, Commissioner Colleen. It's been moved and supported. Roll call vote, please.
Commissioner Marecki, Commissioner Marecki,
Yes, sorry.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. Motion passed. Any objections to this motion? All right, next item, please.
Item 4 on the addenda, forwarding notification of an emergency procurement report for a contract with an option for up to a 12-month extension with Med National Staffing Solutions.
Madam Chair, wasn't there an item 3 that did we gloss over that for a minute? The annual contract with the state of Michigan to fund our health programs?
Actually, that was what we just covered.
Was I one behind then on the?
Yes, you kind of went back to the first.
Oh, geez,
to the
I guess I
second
had
item.
that.
Yeah.
Would
but
you
that's-
allow me one question on the previous one then, Madam Chair?
Um,
Because I did have a question on that. That's why
oh, okay. We can go ahead with the question. The vote has already been made, but go
yeah,
ahead.
I know.
Mm.
Well, it was a healthy decrease from the state of Michigan, $2 million in funding. This is that big omnibus thing we get from the state of Michigan.
Mhm.
So I was wondering what the state of Michigan, where they dinged us to the tune of $2 million on this. Are there things we're not going to be able to do?
Yes, Carol Osterberry through the chair. This decrease, no, this will not. I hear what you're saying, and we had some additional money from, I think, for the COVID response in fiscal year 21, and that's gotten sent into separate accounts. So this is taking us back to this 12,900,000. That's really what we used to always see.
Okay.
Is where that difference is.
Okay. Last year was slightly inflated then because of COVID.
You are correct.
Thank you for allowing me to do that, Madam Chair. Now I'll try to pay attention.
No problem. All right, so
Maybe not for you, but apparently it is for me.
Item, number 4. Can we have the director discuss this item?
Yes, Carol Osterberry, and this is for a contract that we had with a staffing company for the COVID vaccine clinics, Med National Staffing Solutions. And we had put this through as a emergency procurement, and this is coming through now as their, as receipt and file.
Okay, so this is a receive and file item.
Yes.
Okay, it's not approval. All right. Any questions on this item? And in fact, the next one is receive and file as well, isn't it?
That is correct.
Yes.
So let's take those. Is there the 6th item? Don't we have one other item? Right. Is this receiving
The
file?
last one is an approval.
Okay,
Yes.
great. All right, let's take these two together. But before we do that, looks like Commissioner Dobb had a question.
Thank you, Madam Chair.
Mhm.
So these two reports, they list the locations for the Wayne County Community College for Downriver and Schoolcraft. Were those the only two places that we used staffing for
Yeah.
this? Okay.
Yes, for this company, that's where we use the staffing. That's correct.
Okay. All right, because I know that we had other locations, but so that would come under a different report.
You are correct.
Okay, got it. Thank you.
Thank you, Commissioner Dobb. Any other questions? Commissioner Colleen, did you have your hand raised?
Yeah, I did. I'm trying to get good at that and then lowering it when I'm done.
Okay.
Ms. Osterberry, did we RFP these things or did the state say these are the people we want to fund in your area? Who picked these locations?
The locations for the staffing companies.
Well, yeah, the staffing company. But for what
Yes.
we're paying for, was that our choice or was it the state of Michigan's choice?
No, these were our choices. We because they were run through as emergency procurements at the time. Remember when we were working,
Right.
so to get those clinics up and operational, we needed to be getting vaccines into people's arms. So these were run as emergency procurements under the procurement ordinance. And these were, but we did have multiple vendors that were providing those services. It wasn't just one vendor.
Okay, so that's what I wanted to be clear on. Sometimes the state says, here's the money and here's who you're going to do business with. I was just wondering if this was the case. Thank you. Thank you, Madam Chair.
Thank you,
And can
Commissioner.
I move items 4 and 5 for receive and file?
Thank you. Is there support?
I'll support.
All right, roll call vote, please.
Voice vote.
Voice vote. We couldn't do a voice vote because this is receive and file. All right. All those in favor?
Yes.
Aye.
Aye.
Any opposed? Any abstention? All right, motion passed. Next item.
Item 6, requesting commission approval of a grant agreement with the Michigan Department of Health and Human Services.
Thank you. And can we have someone talk to this item?
Yes, once again, Carol Osterberry, Health Officer, Health, Human and Veteran Services. And yes, this is a funding from the state. As it says, it starts October 1 through September 30th next year. And this is for COVID response. And we are using these funds for case investigators and contact tracers, for our support staff that we need, the staff to investigate the cases.
Okay. Is there, and through the state process, is there a way to select other vendors for this?
This is paying for individuals. We actually have individuals who we hire in as those case investigators and contact tracers. So we,
I see.
yes,
Okay.
that's what, these are individual positions.
So we actually hire them?
Yes.
Wayne, I see. Okay.
I'm sorry. I have to learn how to put my hand up.
Oh, go right ahead.
I was just going to add, we certainly have opportunities to train more people to do case management so that they can do follow-up.
Yeah, Glenn.
I'm sorry about that. Go right ahead. It seems like
So I was just trying to say that as we try to do case management, as Carol has mentioned, and to do the follow-up for contact tracing, we certainly can train more people to be able to do that. across the country, people have been able to take courses so they can learn how to do contact tracing, so that we train individuals that may be interested in being able to go out and assist health departments, local health departments, county health departments, and state health departments being able to do this type of work.
Okay, so is there a posting for this job?
Well, it's not, well, we're currently working with SEMHI at Carol.
Oh,
So
yep,
we are
yes,
working
yes, that
with,
is correct.
in terms of working with an agency to get people for us. And so they actually post and go out and do training so that individuals can get that type of experience. And then they are deployed to various places to help the local health departments in order to do this work. So we're continuing to make sure that we have enough people that can follow up on positive cases.
All right, thank
We
you.
work with
Any,
schools of public health to get people that, are interested in doing this, because that is similar to what we used to do when we did follow-up cases on STDs and STIs. We literally send people out to follow up on case management.
thank you.
You're welcome.
All right, any other questions from commissioners? All right,
Move for approval.
been moved. Is there support?
Support.
Been moved and supported. Roll call vote, please.
Commissioner Mareki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
We can't hear you.
Thing, aye.
Chair Baker McCormick,
Yes.
The challenges.
All
of-
right, any opposed? Any abstentions? All right, there's none. Motion passed. Next item.
F, such other matters as may be properly submitted before the committee.
Madam Chair, I have a quick one.
Sure.
Thank you.
Commissioner Anderson.
Yeah, I just wanted to update everyone because I know the question was asked, I think, by Commissioner Dobb earlier, that apparently Moderna has not been authorized to give the booster shot, and their submission to the department, appropriate department, they said they are still lacking in some information. So it has not been approved yet. And they, as we had known previously, but even the process now, they're lacking in something. So it's still not, looks like may not be approved very quickly, but there is a delay in it. That's all. Wanted to just update everyone. I just saw that come across my news feed.
Thank you for that update, Commissioner. All right, any other commissioners' comments? No. All right.
Madam
Yeah.
Chair, this
Yes.
is Pam. This is Pamela. I just wanted to confirm that on item number 2, staff has looked in the records and it has been shown that the initial item was retro, and that's why it's referenced as retro here.
Okay. Thank you.
You're welcome.
All right. All right, are there any other matters? If none, next item, please.
Public comments.
Okay, are there any public comments? You can unmute everyone.
The lines have
Any,
been unmuted.
okay. Any comments from anyone? All right,
We do have some email comments.
okay, go right ahead, Madam Clerk.
This is from Stephanie, last name Vandine. It says, Board of Commissioners, I ask you all to stop breaking the law of Michigan and the United States Constitution by requiring any human being to wear a mask. It is illegal to force people in schools to have their oxygen restricted and immune systems put at risk for carbon dioxide poisoning, and other immunosuppressive germs being constantly re-inhaled. The restrictions and mandates have done more damage than the COVID virus. Discriminating against those who cannot mask up or take an experimental injection has gotten out of hand, turning Americans against each other over money. This has never been about our health, only about tyrannical control and money. Choosing to put children, especially at risk for mental health issues, in addition to physical health issues, is on you. Your decision to continue putting students, teachers, and faculty at risk for further respiratory issues will not go unaccounted for. I pray you look at facts, actual facts that you go and find, not media rhetoric, but actually read a CDC page and see how many issues have come from masking children. The number of suicides and other respiratory illnesses have spiked since mask mandates have been introduced. The number of children testing positive for COVID did not spike until after more adults were injected with the experimental gene therapy. Mandating injections has made humanity sicker. Stop mandating medical procedures. There is no one size fits all when we are all different. The hundreds of thousands of reported adverse reactions, injuries, and deaths to this injection should be enough to make you open your eyes and follow the money telling you it's not about our health. Thank you for your time. This one is from William Hancock. It just says no mask. This is from Ginger Wilson. It says, why in the world would you continue to require students to wear masks when it has been proven beyond a shadow of a doubt that is harming our children, not just mentally, but physically as well? It's funny to their growth. What in the world is wrong with you people? My children and grandchildren will not wear masks. We've never wanted masks. We are fine. You guys are part of this Luciferian trap trying to push a government on us. It's not going to work, so you can stop now. And that's all for the email comments.
All right, and one more time, any other comments from anyone in the public? Thank you. Next item, Madam Clerk.
Adjournment.
Is there a motion?
Move to adjourn.
Support.
All right, we are adjourned. Thank you so much. You all have a good rest of your day.
Thank you, Madam
Aye.
Chair. You too.